on. Adam is a doctor of veterinary medicine and holds a PhD in wildlife epidemiology. He has 10 years experience as a clinical veterinarian practicing mixed small animal, emergency, and wildlife medicine. He has also spent 7 months working for the provincial government as a wildlife health biologist and leads the field team of the deer contraceptive programs in the Greater Victoria area. He has completed hundreds of wildlife captures, primarily on native Canadian ungulate species. And I think with that, I can hand this over for our presentation. Thank you.
Okay, so thanks everyone for joining us. Hopefully you can hear me and see our presentation clearly enough. Jason Fisher and I will swap back and forth a little bit as we talk about this project and the approach we've taken and the results that we'll discuss later on. So I'm very excited to be able to be here with you presenting about this portion of our work on black-tailed deer in the city and how we went about managing some wildlife human conflict that happens here in Victoria, Canada. So first, to set the scene, we're talking about a municipality called Oak Bay. It's one of the municipalities in the Greater Victoria area. Victoria is the capital city of British Columbia, and it's located on Vancouver Island on the west coast of Canada. As you can see in the bubble there in the screen, Victoria, Oak Bay is outlined in red here. So it's a densely populated urban area that's surrounded on two sides by water and two sides by the rest of the Greater Victoria area, so also densely populated urban area. Oak Bay is one of the more affluent communities in the area, and so there are many large properties with big green spaces and well-manicured gardens in the area, as well as a couple of golf courses and green spaces, and that provides some very nice habitat for some of these deer. And as a result, we've seen growing numbers of deer in the area that has led to some degree of wildlife human conflict in the area. So as public frustrations grew around this wildlife human conflict issue, there were a few main things that people seemed to be upset about, primarily the deer eating their gardens, impacting their gardens. Some deer vehicle collisions are definitely common factors. And in some cases, encounters with deer where people and their dogs would feel threatened, either around the fawning season, where females might act more protectively of their fawns, or around the rut where males might be less interested in being bothered and interrupted in their pursuit of the girls. And so as a result of this, in 2015, there was a cull that took place in Oak Bay. And through that cull, they removed 7 bucks and 4 does, but it was very socially divisive. People were very divided on how they felt about it. Some felt that we shouldn't be killing deer. Others felt that killing deer was okay, but the way it was being carried out was inappropriate. Others felt like it just wasn't a good use of taxpayer money or efforts. And so the community was very divided about that. And as a result, that precipitated the formation of the Urban Wildlife Stewardship Society that went about proposing this immunocontraception program that we'll be talking about more here today. So the project started gaining national attention, as well as just the issue at hand. So here's a little clip from our national news.
This is the face of Oak Bay's deer problem. The picturesque community nestled on the outskirts of Victoria has been taken over by deer.
They get into my backyard, I'm not sure how, but they find a way.
They've become problematic.
They poo on my lawn, they eat my plants.
We've been in our house for 24 years.
And some residents have had enough.
At first I thought they were adorable, and now they are such a pest.
But the overpopulation is not a new problem. The deer have been around for years, so in 2015, the municipality launched a trial deer cull. Didn't go over well.
There was a lot of, I guess, contention around the cull at that time. So there was a proposal made that same year to try an immunocontraception.
Okay, so I'll let Jake take it away.
Thanks. So what's really important here, I think, is the ecological context. So these are native deer. They're Columbia black-tailed deer. They've always lived on Vancouver Island and in the Greater Victoria era. But Victoria was colonized by Europeans in the mid 1800s for fur. A fort was built there. And then in the intervening century and a half, there's been really heavy predator exclusion, as there has been in a lot of urban areas. So native predators to deer here include wolves, black bear, and cougars, all of which are removed immediately as soon as there's a hint of them occurring somewhere in the city. And so we've got this big predator-free area in Greater Victoria and in Oak Bay. And so this increase in population is a result of this societal decision to remove them of natural regulation, as is the problem so many other places. Next slide, Adam. The other critical part of the ecological context here is that we're in a rain shadow of the Olympic Mountains in Washington State, which means we receive just a fraction of the rainfall that, say, like Vancouver or Seattle does, or other communities do on the West Coast. And in fact, we usually have a couple months of drought in the summer. Technically, we're living in a Mediterranean savanna here. So the habitat is actually quite dry. It's quite sparse. It's not great food for black-tailed deer, meaning the populations have been, we think, historically low, as reflective of that poor quality habitat. Since colonization, of course, that habitat has radically changed, and there's extensive gardens throughout most of Oak Bay, and extensive watering as well. So what we've done is we've converted this landscape from a semi-arid kind of food poor landscape into something that provides abundant forage for black-tailed deer, at the same time removing their predators. So we've created, if you will, this perfect storm for there to be abundant black-tailed deer in this landscape. Next. So the Urban Wildlife Stewardship Society gained, I think, acceptance and eventually funding by promoting an evidence-based approach to wildlife control. So as happens in many situations, sometimes wildlife control with the cull, for instance, is just a knee-jerk reaction to show the public that you are doing something, even if it's really not that effective. And so they fostered this approach where we really need some good science to understand if what we're doing is effective or not. And if not, then course correct. And if so, then we can adopt this perhaps more broadly. And so that's when they brought in this association with me at the University of Victoria in order to create a scientific framework for this study. And that hinges really tightly on density estimation of animals in the area. So we had a lot of anecdotal reports about how many deer were in Oak Bay. These ranged from, maybe 500 deer to perhaps 1,000 or 2,000 deer. Nobody had any real idea, though, of what the actual density estimates were. And of course, density estimates are really hard to get in urban areas. You can do road surveys, but there's just so much duck and cover habitat. They tend to have really big confidence intervals on them. And what we needed was a density estimator that had really small confidence intervals. It was quite accurate and precise. And so for this, we fell onto camera trapping, which is something I've been using for about 20 years and helping to develop across Western Canada. So camera traps, they record an animal's presence based on heat and motion, and they're really quite useful for a variety of species, especially something large like deer. Next slide, Adam. So we constructed an array of camera traps across Oak Bay, 39 camera traps across most of the habitat there, based in roughly a systematic design. So we approached landowners and asked them if we could put a camera on their properties, explain the study. We got a lot of support for that. So we have cameras on private properties. We've got cameras on green spaces belonging to the city and other locations as well. So this gives us a pretty good sample about where deer are and where they're not across that landscape. Next. We needed some idea of space use. So for for this kind of density estimation, which is based on spatial capture, recapture, it's really a critical piece of information is how much space that each deer might be using. So we had captured 20 does and put out GPS collars, satellite collars on the animals. These were all on does, so we can get an idea of how much space that each of the does was using, and whether or not that space use was influenced by the application of IC. Next.
Okay, so I'll jump back in here and tell you a little bit about the application of those collars. As you can see, we are working in a very highly urban area, and that changes things a little bit for those of us that have been used to working in more natural wildlife habitat. And I think this picture really captures that, having me walking through the playgrounds with a dart rifle. So we did a lot of public outreach to let people know that we were out and about, give people an idea of what was going on. I was always out with a team of volunteers to complete the different components of the work so that hopefully we could complete the work successfully, but also not be scaring people by walking around town with a dart rifle. And so there was a very large public outreach component. You saw that newspaper or that news segment, and there were definitely TV and social media and radio and newspaper articles. We also had things like decals on the vehicles and a team of volunteers that were out talking to property owners. A big part of the challenge with this work was that most of the time the deer are on private property, and so we needed people's permission to be able to enter their property, and that happened either by knocking on doors and getting permission in the moment, or having people fill out surveys and give us permission to access their property when we saw deer there. And in general, we sort of had to take a very much of a long-term approach in that, there were lots of opportunities that we saw, great darting opportunities and eligible deer on properties that we didn't get permission for, and we just had to let those animals go because property owners weren't home or things like that. And that definitely slowed down the field work, but is a reality in this context that I think needs to be considered and prepared for. And then, of course, taking all kinds of steps to minimize risk to the animals and to the public before, during, and after capture. So that's everything from shot selection to being able to locate the deer after they've gone down, to making sure that they're not hitting vehicles or vehicles aren't hitting them in the process. Because all of this was really under significant public scrutiny and highly visible. And luckily things went very well and have continued to go very well. So very briefly about the actual fieldwork component and immunocontraception component. I want to stress that compared to, in context to the amount of work that's been done, the field work for sure was lots of work, but is only one small segment of the larger project. The chemical immobilization was relatively routine for wildlife anesthesia. We were using darting with a new dart rifle. In the beginning, we were just using regular new darts, but after the first set of control animals, we transitioned over to telemetry darts, and that made a huge difference for being able to take shots, have captures go really smoothly, be able to relocate animals without having to chase them during the initial induction period. Captures just went much smoother. For those of you familiar with wildlife drugs, we've done our captures primarily with BAM, and those have gone really well. The animals were all being fitted with collars. Initially, those GPS collars for being able to give an idea of what space and areas they're using. And then later on, we were just using visibility collars that were just a thin leather collar, or a very lightweight rather, leather collar that could be seen on the cameras, but didn't have any GPS trackability. And then in terms of vaccinations, we were using the Zonostat D vaccine, which is a porcine zona pellucida vaccine purchased from the Science and Conservation Center out of the US, out of Montana. And then giving them boosters 2 to 6 weeks later. So we would do the immobilization during the first capture, hand inject the first dose. And then when we found those animals 2 to 6 weeks later, we would load the booster into the dart and then dart them with the booster and then retrieve the dart without having to immobilize them a second time. So passing back to Jason.
Thanks, Adam. One of the things that allowed us to do this, and the budget for this is not big. It's a reasonably small budget. And one of the reasons we've been able to do that is because we got a really heavy volunteer component to come out and help. So we had members of the community come out and help. We drew on lots of volunteers from students from Camosun College in Victoria, as well as the University of Victoria. This is a picture of my daughter taking a fecal sample for the first time and not enjoying it whatsoever. But you can see from that initial photo and from the photo since, we had a lot of people hands on deck to come and help us to find the deer in the first place, and then capture them and make sure that they were safe and let them go. And so there was an educational component to this and an outreach component that's really critical, and in my opinion, really super gratifying. So it was wonderful to see the community come out in support of the project. Next.
Yeah, and the community component of it, I think, led to a real sense of pride among the community members, because there were so many people that were involved, and really amazing opportunity for students to get hands-on wildlife handling experience that really is so rare. As somebody who was aspiring to go to vet school and eventually got to go to vet school and took every wildlife opportunity I could leading up to vet school, the kinds of things that we were able to get volunteers to be able to participate in are things that I could have only dreamed of when I was preparing for vet school. So that was really neat as well. One of the things that was a part of this project, and is a part of most projects in BC, is we take a set of health monitoring samples that go into the archives. So every animal had blood samples taken and serum archived, as well as ear biopsies and ear tags, fecal samples from some of the animals, hair samples from all of the animals, those kind of things that all go to the provincial archives in case there's need for them in the future. There's lots of issues, as you can imagine, around deer safety and welfare in urban environments. Especially, things are scrutinized. This is a video of one of the deer waking up from anesthesia on somebody's front lawn, and this is quite routine. The owners of this property obviously knew that we were there. In general, when deer were targeted and then became anesthetized on a property that we didn't have permission. Sorry, we wouldn't take shots on the property where we didn't have permission, but if they moved onto a property that we didn't have permission to be on, in between the time that they were darted and the time that they became anesthetized, we would try to get permission from those property owners if they were home, and if they weren't home, or would prefer us not to be on the property, then we would go and collect the deer in this carrying blanket and then carry them off the property so that they could be recovered somewhere else and managed somewhere else. You can see she's just starting to wake up. This was one of the first captures that was done, or at least in this first 20 animals that were I think this is that they really hated those ear tags more than anything. We started using lidocaine in their ears, and that really helped reduce the amount of discomfort that they experienced in that process and how smooth our recoveries were. So little improvements like that were things that came along throughout the project. So just an idea of some of the timeline here. In 2018, we put on those control collars and started doing the camera and data analysis to get an idea of the population. 2019, we gave 60 deer their immunocontraception, and we gave boosters to the vast majority of those deer. In 2020, we gave another 60 deer immunocontraception, and we gave boosters to 46 of those 60 initial first-year deer. And then in 2021, we went out trying to give just the booster vaccines without adding any new contracepted animals to the population. And we found 71 of the 104 remaining deer. And so, one of the things that's a challenge with this kind of project is that not every animal was wearing any sort of GPS collar. So relocating those animals was just purely opportunistic, but luckily, they don't move that far, and Jason's going to talk about that here in just a second. So now for the last couple of years, we've been doing data analysis and evaluating how this intervention has had an impact on the population. Take it away, Jake.
Hey, thanks, Adam. So based on that pre-treatment density estimate, we managed to obtain a density estimate of 72 to 128 deer, median 97. So reasonable confidence limits on that estimate. And this is just a fraction of community predictions. We think that this estimate is probably biased on the low end. So this mode of estimating density based on spatial capture recapture is pretty new. It's only been done a handful of times. Depends on a number of different model parameters, as all models do. So we think it was probably closer on the higher end of that estimate, but still radically less than, say, the 500 or 1,000 or more that community members thought. So when we came up with this number, that really changed a lot of the conversation in Oak Bay at that time, as they realized that while there's not nearly as many deer here as we think, we're not really being overrun by deer, as you saw in the rhetoric in that news clip, but instead there's just the deer are here. One of the reasons that people think there's so many is the next slide, Adam, is that they have really, really small home ranges, like 0.6 square kilometers. So they're basically just occupying an area and very small area, and they're just motoring around over and over and over and over again. So again, by putting all this unique taggery on the deer, one of the things that the community noticed is that when they're sitting on their front porch and they see a deer go by, and then another deer and another deer and another deer as they had before, and they assume that was 20 deer, in fact, it's the same deer 20 times, right? And so again, that really changed the nature of the narrative in Oak Bay and helped people to realize that this isn't nearly as many deer as they thought, and that deer are really hyper concentrated to a very small area. And of course, this is also reflective of the fact that there's so much good available forage for them. They don't need to have big home ranges. And of course, male home ranges we expect are going to be larger. So this is all data from females because that was the focus of our study. But even so, we could anecdotally see that bucks were using pretty much the same areas over and over again. So, and they're concentrated in very specific areas in Oak Bay, which is one of the outcomes of the analysis that we saw. So they weren't uniformly spread. We tried to spread our survey effort across the entirety of Oak Bay as best as we could. So we put a lot of effort into the areas where we were seeing less deer. They were coming less frequently, but we're still pretty confident based on where we got callers out that where we didn't get callers is because there's much, much fewer deer. Next slide. So, so what we found when we used the camera data to compare the fawning rate. So in this case, fawning rate is based on a relative abundance index. So the number of fawns observed on the camera per active camera days. So what we found is that in 2018, pre-treatment, our fawning rate was like 9.4. It climbed a little bit to the next year, which I think is reflective of natural population dynamics. Sorry, that's the adult rate is in purple and the fawning rate is in pink. So the adult hit rate on the cameras is 9.4 and the fawning rate was 5.1 in 2018. And then in 2019, both of those increased a little bit. And then so after you've had a year for the immunocontraception to actually work and you've seen the result of the reduced fawning rate, that's in 2020 when that really picks up. So although there isn't a change in the population, it's pretty stable. The adult population there in purple, 12 to 11.9, pretty much exactly the same. You can see there's been a drop in the fawning rate there in pink down to 2.5. And although the population remained stable again in 2021, again, that fawning rate dropped lower down to 1.9. So overall, from what we've seen is a 57% reduction in fawning rate over this very short-term period after the implementation of immunocontraceptives. So that gives us a lot of hope, right? So that means that at least we know that the IC is doing its biochemical job. It's preventing pregnancies. There are much fewer fawns being observed and being produced into this population. Now, of course, what we're waiting for is natural mortalities to reduce the adult population. And so we expect, in principle, that with the reduction of fawning and then with natural mortalities, then that population should decrease over time. one of the reasons that we stopped immunocontraception when we did is that the point of this is to see how the acute short-term couple-year application of IC can reduce a population, as opposed to we're implementing IC every single year for a long period of time, which we think is pretty much guaranteed expected to bring that population down. So what are the effects of this pulsed application was the first part of this proposal. So what we're in now is the monitoring stage to see how that population is going to respond over 22, 3, and then hopefully 4 and 5 into the future. Anything you wanted to add to that, Adam?
No, that sounds great.
Go ahead, take it away.
Okay, so yeah, I didn't want to, we're just about wrapped up here, but I just didn't want to finish us off without talking about the huge public outreach component and community engagement component that happens through the Urban Wildlife Stewardship Society, because I think that's really essential to the success of this whole project. Because I think for sure one part of it is the absolute number of deer, but as Jason talked about, the perception of deer is a huge factor here. It's not necessarily that the deer is above the ecological carrying capacity, but maybe it's above the social carrying capacity. And so first of all, when we're out doing this work, people really care about the deer. That's why they hated to see the cull happen. And so for sure we are being scrutinized, and I'm happy to say we had some really good feedback from lots of people. Occasionally, of course, we had some less good feedback, but that's part of the nature of reality. But also the Urban Wildlife Stewardship Society does a great job of reaching out to the public and talking about and addressing their concerns, talking about some of the things that they should be considering. So you can see here's part of their FAQ page about answering questions. One of the most common ones that we got from people is why we don't sterilize bucks instead. And when we just sort of talked about the ecological component and how we can have bucks coming in from outside the study area and getting all the girls pregnant, most people understood pretty quickly. And then they also do things like talking about deer resistant gardening and talking about times of the year, putting out things on their blog talking about times of the year to expect that animals might be need a little bit more space, and being proactive about that communication. And I think all of those components, in conjunction with the fact that people are starting to see that there are fewer deer than they thought, they're seeing the same deer all the time, is a really big part of the success of the overarching project, which is just generally accepting that the deer are here, they live here, we share this space with them, and learning to coexist with them peacefully, which is ultimately the goal. And so I'm really pleased with the progress that's happened on the social front as a result of all of the efforts of the Urban Wildlife Stewardship Society, and the immunocontraception just being one component of that larger success.
To thank you both again for your time. This is amazing work that you're doing, and we can't wait to hear more about the second site that you've mentioned a little bit during your presentation today. I hope we can have you back to talk about that once the project is a little bit further along.